Welcome back. Establishing a collaborative relationship between a contact tracer and a contact may help people to self-isolate, quarantine, and take other measures to prevent disease spread. We know from research about other conditions that people who collaborate in making their care plan are more likely to adhere to the care plan. Unfortunately, it's all too easy to take a tell approach when we interact with contacts. Tell is telling contacts what to do without asking about their understanding, thoughts, and preferences. Understandably, this can lead to frustration for both the contact and the contact tracer. In the following scene, we'll see how a contact tracer uses a tell approach and misses an opportunity to engage the contact.
You've been in close contact with someone who has COVID-19, and even though you feel well now, it is possible that you're also infected. It can take 2 to 14 days to show symptoms, so we may not know for up to 14 days if you are infected or not. Because of this, it's important that you quarantine for 2 weeks so that you don't pass on the infection to anyone else.
Seriously? For 2 weeks?
I'm afraid so. The best ways to prevent spreading the virus are to restrict all activity and separate yourself from all others. You should stay home, postpone all non-essential medical visits, and use a separate room and bathroom in your home if possible. You should avoid having visitors over, or handling pets, or caring for children, or preparing food for others. Do you have any questions?
I can't do all that.
In the previous dialogue, the contact tracer misses an opportunity to collaborate and build trust with the contact. His tell attitude prevents him from learning about the contact's understanding of quarantine and any barriers she may be facing. He does not ask permission to discuss her quarantine. In fact, he does not ask any questions whatsoever, which prevents him from discovering more about her motivators, challenges, and questions. So what's the alternative? The alternative is an approach called ask, tell, ask, in which we ask a question, tell the contact information they do not know, and follow up by asking another question. Be aware that there are closed and open-ended questions. A closed-ended question would be, can you get food while you're in quarantine? The answer is yes or no and does not invite the contact to share any more information about their situation. An open-ended question would be, how will you get food while in quarantine? Which invites the contact to share additional information. In Ask, Tell, Ask, we encourage the use of open-ended questions. The following are the steps to Ask, Tell, Ask. 1. Ask. Begin with an open-ended question to learn more about the contact's perspectives, knowledge, or plan. 2. Tell. Provide contacts the information they do not know or that they have incorrect. 3. Ask. Ask another open-ended question to close the loop. Let's talk more about this last ask, closing the loop. Closing the loop is asking contacts to provide information that you have provided in their own words. When we are speaking to contacts, we often use jargon such as quarantine, social distancing, or self-isolation. Additionally, we add instructions to that jargon. All of these details, terminology, and instructions can be confusing and overwhelming for the contact. In healthcare, research has shown that people remember only 50% of what their provider tells them. This poor recall and understanding can have serious consequences for our contacts. The good news is that people remember remember 90% of what they teach to someone else. Closing the loop is not only a technique to check how someone interpreted the information we provided, but also to help that information stick in their minds. I recommend closing the loop in a way that puts the responsibility on you to have provided the information in a clear way. For example, just to make sure I explain that well, would you mind describing it in your own words? Or, just to make sure we are on the same page, what do you plan to do going forward? Or, we covered a lot of information today. Would you mind describing it in your own words? In the next scene, we'll see a contact tracer use Ask, Tell, Ask to engage the contact as an active partner in planning their quarantine. As you watch, try to identify the open-ended questions that the interviewer uses, and we'll discuss it after the clip.
You've been in close contact with someone who has COVID-19, and even though you feel well now, you could be infected. It could take 2 to 14 days to show symptoms, so for the next 2 weeks, we are asking you to do something called a quarantine. Would it be okay if we talk about quarantine?
Okay.
What do you know about quarantine?
Well, I guess it means I should stay home and not have visitors over.
That's a good start. Staying at home and keeping a distance between you and other people in the house is the most important thing you can do. May I share a few other important actions to take?
Yeah, of course.
You should use a separate room and bathroom in your home if possible, and avoid sharing household items like towels and utensils. We also encourage people to avoid handling pets or caring for children and preparing food for others. So what do you think about all of that?
It's a lot to take in.
We can talk about more what it looks like for you and if we might have any resources to help. Before we do, I want to be sure I don't miss anything important. We've covered a lot of information. Would you mind describing in your own words what quarantine includes?
Well, in addition to not going out, I should stay away from the other people in my home and not share items with them or prepare their food.
Exactly. How does all that sound to you?
In the example we just saw, the contact tracer uses Ask, Tell, Ask to assess and build on the contact's understanding of quarantine. Let's break down the dialogue to see how he uses the steps of Ask, Tell, Ask. First, he asked permission to discuss quarantine. If the contact were busy or distracted, this would have given him a chance to call back later. After that, he assessed the contact's understanding of quarantine by asking, "What do you know about quarantine?" He then built on her knowledge by providing additional information and asking a question to find out how she felt about all of the information. What do you think about all of that? Finally, he asked an open-ended question to close the loop. That is, to describe what she understood from the conversation in her own words. Ask, Tell, Ask, and closing the loop are great tools for providing a significant amount of information, reviewing a contact's action plan, and checking understanding of important information.